I decided to do my paper and my project on Parkinson's disease. I specifically chose this disorder because I thought that it was really interesting, and I chose to interview a speech language pathologist named Suzanne Sylvester. So I actually have interned with her before and shadowed her for my internship freshman year, and I decided to interview her again for this project. She talked a lot about different neurocognitive disorders, and specifically, she talked about Parkinson's disease. I thought it was really relevant to this course, and she talked a lot about the symptoms of Parkinson's disease and what a person would look like who has Parkinson's, as well as she talked about the treatments that are involved with this disease and how the treatments can help slow the progression of Parkinson's disease overall. So I decided to interview Suzanne, like I had just mentioned. She is the owner of Scarborough Neurodevelopment Center, and just for a little bit of background, Scarborough Neurodevelopment Center is located in Scarborough, Maine, and it's a facility that offers services involved in neurological development and rehabilitation. Specifically, they provide speech and occupational therapy services. And in terms of her credentials, she got her Bachelor of Science degree in neuroscience. She got her master's in science and communicative disorders. And on top of that, she has 18 years of experience as a medical speech language pathologist. Specifically, she has a specialty credential in treatment of stuttering and fluency disorder and certifications in therapies such as interactive metronome, IM for short, vital stim, and alpha stim. So, interactive metronome and alpha stim were two treatments that she really emphasized and talked about for treatment in terms of individuals with Parkinson's disease. Interactive metronome basically works as a therapeutic modality, and it helps with cognition and motor skills in the brain. And then alpha stim is a cranial electrical stimulation used for treatment for patients who experience anxiety. And this is relevant to Parkinson's disease because oftentimes patients will develop anxiety throughout the course of their disease. Another certification that she has is vital stim, like I just said, which is a neuromuscular electrical stimulation for swallowing. The prevalence of Parkinson's disease is about 7 to 10 million individuals worldwide are affected. And out of those individuals, about 1 million of those are affected in just the United States alone. So, Parkinson's disease is the second most common neurodegenerative disease following Alzheimer's disease. And males are 1.5 times more likely to develop Parkinson's than females are. Parkinson's disease is otherwise known as PD for short. It is a progressive neurodegenerative disorder. So, Parkinson's disease mainly affects dopamine-producing neurons. These dopamine-producing neurons are located in a specific part of the brain called the substantia nigra. So, the substantia nigra is part of the basal ganglia, which is in charge of inhibiting unwanted motor activities. So, in a patient with PD, these neurons are damaged and eventually they die off over time, which leads to the loss of motor control and mental disabilities in that individual. So this is just a quick video explaining what happens in the brain when individuals with PD lose motor function, and I just thought it was important because it basically just talks about what happens to the dopamine in the brain.
When a person intends to make a movement, this inhibition is removed by the action of dopamine. As dopaminergic neurons are progressively lost in PD patients, low levels of dopamine make it harder to initiate voluntary movements.
So a main emphasis that we talked a lot about during the interview were the symptoms of a PD individual. So symptoms develop slowly over the years, and Suzanne had said that this is because the progression of the symptoms differ from person to person because of how diverse the disorder actually is. She also mentions that individuals with PD usually won't present with symptoms until later in the course of the disease, due to the fact that a lot of the neurons have already been impaired later in the course and they have died off. They have died off, which makes the individual present with symptoms. The most common symptoms that she talked about and the symptoms that she typically sees in her patients with PD include tremor, usually in the hands, limb rigidity, bradykinesia, which is slow movement, problems with walking and balance, and then dysphagia, which is when an individual has difficulty with speech. So the diagram on the right basically outlines all of the symptoms of Parkinson's disease, just more other symptoms. Also, later as the disease progresses, some other symptoms may include behavioral changes. So these behavioral changes can lead to anxiety, depression, and also cognitive impairment later on. So this is just a picture of what an individual would look like that has PD. So the individual on the left is a female and the individual on the right is a male. So this is just showing what they would look like and other symptoms that they may experience while having Parkinson's disease. In terms of diagnosis, PD is diagnosed by a neurologist. Although there are no specific tests to diagnose the disease, diagnosis is made based upon medical history as well as a neurological and physical exam. Suzanne also had mentioned that the main thing that's evaluated when making a diagnosis are the signs and symptoms of the individual, so that's really important when making a diagnosis. A doctor may also order blood tests to rule out other conditions as well, and PD can take time to diagnose. So even though PD itself isn't fatal, the complications that can occur within the disease can be fatal. There's no cure for Parkinson's disease yet, but there are treatment options that can help and slow the progression of the disease. Lifestyle changes can also be really important to the individual, especially during the early stages of the disease, because it can delay the start of medications. The three main treatments that Suzanne had talked to me about were medications, therapies, and surgery. Specifically, she focuses on therapies with her patients. Medications are basically used to target the increase of dopamine in the brain, which can help with motor function. And then therapies that Suzanne uses often with PD individuals are interactive metronome and alpha stim, like I had mentioned earlier. So interactive metronome helps with the cognition and motor skills in the brain, while alpha stim is cranial electrical stimulation. So that basically helps with anxiety, and that relates to PD because PD individuals oftentimes develop anxiety throughout their disease. And these therapies are used to slow down the progression of the disorder. And Suzanne had said that in her work they have seemed to be very effective with her patients. Surgery is also another option, and that's again just to help treat the symptoms and help slow the progression, but none of these treatments really cure the disease itself. I also think that it's important to note that you can still have a good quality of life living with Parkinson's disease as long as you work with your doctor and their recommended therapies or interventions that they suggest. These are all my references, and that's the end of the presentation. Thank you.